Thank you for joining us today. This is Stephanie Hall, and I have on the phone with me also is Julie Moss. We're from the ESRD National Coordinating Center. Today we're going to be doing the End-Stage Renal Disease Network Peer Mentoring Program for Dialysis Facility presentation. Before we get started, I just have a couple things to go over. This call is being recorded today, and all participants have been muted upon entry into this webinar. However, we do want to hear from you during the call. If you have any questions for Julie or myself, please submit them via the chat or the Q&A feature. And at the conclusion of this presentation, we will answer as many questions as the time allows. So this call is going to offer an introduction to the ESRD Network Peer Mentoring Program. The information being shared today provides a framework for the ESRD networks and the dialysis facilities to implement a patient peer mentoring program. This introduction doesn't provide all the answers on how to implement a peer mentoring program, but instead it does provide a modest guidance which can be adapted to meet the needs of the dialysis facilities, patient peers, and the networks. The successful implementation of the peer mentoring program is dependent on a strong partnership between the dialysis facilities, the ESRD networks, and the peer mentor and mentees. The ESRD NCC welcomes this opportunity to support the peer mentoring program implementation, and we look forward to helping to advance this national program rollout. Matt, if you could, next slide. So here's a little of agenda of what we're going to be doing today. We're going to be talking a little bit about the background of the ESRD Network Peer Mentoring Program. We're going to give you a little bit of the peer mentoring program overview. We'll talk about the selection of peer mentors and mentees. We'll talk a little bit about our Kidney Learning Hub. We'll also discuss the orientation process for mentors and mentees. And we'll discuss peer mentoring, and then we will kind of at the end, finally talk about tips to operationalize the program. And then, as I mentioned, we will be taking questions that you submitted either through the chat or the Q&A feature today. Next slide. So let's start today with a little bit of the background of the peer mentoring program. So the ESRD NCC conducted a literature review and an environmental scan to identify some current peer mentoring programs that are already out there for chronic disease management, including, of course, the kidney disease. What we saw is we saw that ESRD Network 5 had developed a peer mentoring program called Peer Up, and that iPro had a Peer Mentor eUniversity program. We also partnered with networks 2, 5, 6, 10, and 11, and a variety of patient subject matter experts to review any of the materials and all the materials prior to our pilot launch. We also collaborated with networks 4, 5, 13, and 14 to recruit peer mentors and mentees to pilot the program and then mitigate any program barriers. And lastly, we consulted with ESRD Network 16 and 18 and the Road Back to Life Peer Mentoring Program to validate opportunities to enhance our program promotions. Next slide. So what is the ESRD Peer Mentoring Program? Well, it's a patient peer mentoring program between dialysis facilities, patient peer mentees who are new to dialysis, patient peer mentors who have been on in-center dialysis or a home treatment option or transplanted for over a year, and of course your ESRD networks. The peer mentoring program also offers facilities a way to engage our patients in the care and increases knowledge, their confidence, and social support for those living with kidney disease. And it relies on collaboration between the facility staff, the patients, and the ESRD networks. Next slide. So getting started. So how will we get started on this? What is the process for selection of facilities? Well, If you're interested, you can contact your network and you can volunteer to participate in the peer mentoring program. Or the networks may be looking at identifying facilities based on a few criteria. If you have a high number of new patients in the facilities, if it's an area with high COVID-19 cases, if their facilities are having access to care issues, or maybe the facility doesn't have any established peer mentoring program. They might be looking at those types of facilities to implement this at. Next slide. So a little bit about the peer mentoring program overview itself. So the peer mentoring program offers an environment for patient peers to provide social support for managing and thriving with kidney disease. The ESRD network will provide the dialysis facility with promotional material. So there's things like flyers and posters that will promote the program, that gives a little bit of information that you can share with your patients. You could post them at the facility, either by I know a lot of patients are still not in the waiting room, but maybe posting them by the patient's scales, or handing them out, or even share with transplant centers. The facility or the center staff will verify that the peer applicant meets the criteria for being a mentor or a mentee, and we'll talk about that criteria in just a little bit. And then also the ESRD Peer Mentor Champion will conduct like a phone screening or interview to assess the proficiency of the applicant, to make sure they understand all the guidelines and requirements to participate in the program. Next slide. So the peer mentor and mentee completes training on a learning management platform called the Kidney Learning Hub, which we'll talk again. Julie will talk a little bit about this in a few more minutes. There is some requirements for the peer mentor and mentee, some courses that are there that have been developed that we'll talk a little bit about. And then once they complete that training, the peers will be matched by the network using the application information that the potential mentors have submitted and information that the network has obtained by doing the phone screening. The network peer mentoring champion then will establish routine check-ins during this mentoring sessions, during the mentoring process. That would be between the facility, the mentors, and the mentees. So they're going to be doing like little check-ins. Next slide. So let's talk a little bit about the criteria for mentors and mentees. So for the mentor, this is the person who's going to actually be doing the mentoring. They are someone who is receiving or has received treatment at the dialysis facility for more than 1 year, with at least 6 months of their treatment performed in center. So if it's somebody who has been at your facility for at least a year, or at least 6 months have been in center, but then they have switched modalities to doing either a home modality, or if they've been fortunate enough to go on to become transplanted, they could still become a mentor. Another criteria will be that they are needing to be willing to complete all the required courses as part of the peer mentor program. We'll talk a little bit about what those courses are and how many are required. They are to be assigned to no more than 2 mentees at a time. We feel like that's more than enough for any mentor to have. And then they have to be willing to dedicate necessary time to provide that ongoing one-on-one support to another patient. So they have to be willing to meet probably at least weekly, let's say. You know, they could do more, but at least weekly with their peer mentee. The mentee has to have received or have received in-center hemodialysis treatment at the same facility as the assigned mentor. So the mentee is going to be someone a little newer to dialysis, may need a little more information, a little more support. So this is somebody who's a little bit newer at the facility level. both mentor and mentees must be an adult over 18 years of age, comprehends the English without the aid of a support person, or is fluent or native speaker of the mentor's native language. And they have to be willing to commit for the duration of the mentorship, which, like I said, they have to be willing to meet and do sessions. They would have to, there's some surveys that may be required for them to take and feedback, participate in the routine check-ins, and etc. And both the mentor and mentee do need to sign a confidentiality agreement. That's very important because of the information that may be shared. We'll talk a little bit about that in a little bit later, but we really want to protect everybody's confidentiality, the mentor and the mentee. So next slide. So the ESRD network telephone screening, as part of the peer mentor champion for the network, they will be calling these potential mentors. They'll be talking to these. They'll be asking them reasons why the patient wants to be a peer mentor or are requesting mentoring as a mentee. They'll also be going over the requirements to complete the training, making sure they understand that it will be required for them to do 3 basic courses and then an additional topic course. So all inclusive, the mentors are required to do 4 training courses, and they must be able to pass the quizzes. They can take extra classes too. There's a total of 6, and they cover things like home transplant and new to dialysis, but the minimum requirement is that. So we want to make sure they understand those training requirements before they kind of dive in and commit to this, and also be able to take the quizzes. The mentor and the mentee responsibility to attend the peer mentoring orientation. There will be one time that both of those need to attend, about an hour peer mentoring orientation class. And it will be done virtually. It is done through WebEx. And then the possibility that mentors may meet up to 2 peers weekly. So again, it is a little bit of a time commitment. We want to make sure the potential mentors understand this and are fully aware of the requirements. They both need to understand that the maintenance confidentiality, understanding the difference between sharing a medical experience and giving medical advice. The mentor, again, the potential mentor, needs to demonstrate a positive behavior and the willingness to be active in their plan of care. And they need to be willing to share their experience with others, be comfortable with speaking, and be comfortable with just sharing their experiences. The next slide. I think now I'm going to turn this over to Julie. She's going to be going through the next couple of slides with us. Julie? You're on mute.
I just want to...
Oh, there you go.
Thank you. Thanks, Stephanie. So before I get started, just a couple of things. I want to circle back and recap. We just gave a lot of information out in the first 11 or so slides, and just talk a little bit again about the collaboration between the ESRD networks, the dialysis facilities, and the patient peer mentors and mentees. Obviously, in peer mentoring, we have a highly relationship-centered program here, so it's going to take that collaboration between everybody. And we have to recognize, I think, as a team of people on this call, as well as teams working in our network areas, and for those of you doing the robust work in your facilities, that not everyone probably will be able to be a mentor or a mentee, and that's okay. That's really okay. But I think that networks are going to be working closely with facilities to help ensure that those patients receive information to support groups and other areas that they might need to feel better about themselves, feel better about the disease that they have, and how to fully engage and maybe work towards being a peer mentor or being eligible to be a mentee in the program. So again, just a recap on a lot of information there on a very relationship-centered approach to one-on-one mentoring. So we will start here with the Kidney Learning Hub, and I can see on this slide, I wish I would have put the address of the Kidney Learning Hub on it, but I will tell it to you because it's super easy. It's kidneylearninghub.com. And you'll be able to go in, and the page that you see on this slide, you'll be able to see without registering or creating an account on this learning management system. Once you go in and you select patients as the initial check-in place, you'll see this page, peer mentor role, peer mentee role, and resources. And each one of these pages gives a little outline as to what could be expected from this program. So next slide, please. So the peer mentoring role, this page is going to talk about some of the things that Stephanie just went over. What do I need to do to become a peer mentor, assuming that they might be referred to the Kidney Learning Hub before. If they're really interested, they could come on here and see what it's all about. The section here, what will I learn in the courses, just gives some brief bullets on information that folks are going to learn in the courses. We're going to talk about those in just a second. And how do I start the peer mentoring education program? And that's where it's going to tell peer mentors that they'll need to register and create an account. And we referenced at the very beginning that we had a pilot program, which we did, and had, I guess, somewhere over 40 peer mentors actually want to sign up to be a peer mentor and go through this process, of which about a quarter of them actually went on to the learning management system and went through the courses with little to minimal difficulty, but there's lots of support mechanisms available in the Kidney Learning Hub as to if they get stuck or how to notify us for one-on-one technical support and the hours of operation that we provide that. So how I get started is pretty step-by-step process for them. Next slide, please. So peer mentors, once they've gone through that, they can go on and see the courses. We have mentoring basics and we have topic courses. As Stephanie mentioned earlier, the mentoring basic courses are required and they are sequentially aligned. In other words, I can't move to course 2 unless I pass course 1, and I can't move from course 2 to course 3 unless I pass course 2. So again, those are all lined up, and when you get through all 3 of those courses, you'll receive a certificate of completion as a peer mentee, or excuse me, a peer mentor, and that will be facilitated through the network. And again, it is not a certification of being a peer mentor, it's just acknowledging that you've completed these courses. Stephanie referenced that each one of these courses has a quiz that has up to 3 times that can be passed, and we want to reassure everyone on the call, and we've reassured the mentors that went through the program and all of our patient subject matter experts that helped us design and create this work, that the quizzes there's no trick questions, they're right from the material. And each one of these courses is offered in a print book format, so downloadable, I should say, not printable, downloadable format, so it'll be available on your computer as you're reading it or taking it. And there's an audio version that folks can listen to and follow along in the book. So there's a voiceover that records the courses. The topic courses are where a lot of information that we hope peer mentors and peer mentees will be able to exchange with one another. Those really important goals that we're all working on together as healthcare professionals by improving access to home dialysis, improving access to transplantation, and understanding a patient's perspective in being new to dialysis. So there's some really great information in each one of these courses They go into things like vascular access, the difference between peritoneal and hemodialysis, how I can do home dialysis, my options for that, how to contact, what action might I take for that, why I might want to get on the transplant wait list, who can I talk to. So lots of really good information in these courses. We've received a lot of positive feedback and inclusion from folks when we created the courses as well. So next slide, please. So again, going back to the slide we first had up, we had the peer mentor role, the peer mentee role, and then we had resources. This is the peer mentee role. Mentees are offered 3 courses. Those are What the Peer Mentee Should Know, End-Stage Renal Disease Overview, and New to Dialysis. Peer mentees do not need to sign in and create an account that we would follow through the process. Necessarily be a mentee. We highly recommend that mentees take a peek at these courses. Again, they're authored, as you can see, very tiny, I know, is in a PDF format, which is readable, or audio that you can listen to. And we will be able to see how much activity we have on the peer mentee page as we set up tracking on these so that at least we know in general, the page views. We might not necessarily know that they're attributed to a mentee, but we can see the activity. And again, it talks about what do I need to do to become a mentee, what will I learn in the courses, and how do I start the peer mentee courses. Next slide, please. So the Kidney Learning Hub itself, the NCC, the ESRD National Coordinating Center, it provides a lot of information for us. We're able to track mentor progress. We can see that myself, Julie Moss, I logged in, I created an account. The NCC is notified when I might do that. So that helps us be able to notify, my ESRD network that I've actually gone ahead and created the account. And that's really important probably for anybody because for the facility and the network, because if they've got someone who, like Julie Moss, who might be interested in becoming a peer mentor, we want to know, like, oh, she might have expressed that interest right now today, but how long did it take for her to go in and log in? We report back that she's logged in, she's created an account, and she's actually in progress in course 1. We can see where she is in that progress, and we can track when she's finished. We can see if she's taken a quiz and not passed it, if she's on quiz 2 or quiz 3. So it gives us a lot of information and allows us to stay in close contact with the ESRD network, who then in turn can stay in close contact with facilities. The NCC will provide technical assistance to peers that are taking courses in the Kidney Learning Hub, and there's a substantial area of support in the hub itself that provides a pictorial tutorial on how to navigate through the Learning Hub and a frequently asked question guide, as well as a support form. So folks will be able to, if they're struggling, they'll be able to go to support and they can submit a support form that comes into the Kidney Learning Hub email box that is manned by myself and Stephanie and a team of specialists at the NCC, so that we can support any technical assistance requirements that come in. We list the hours there so that folks who might be taking it on the weekend or after hours know when the next time they might get that support that they need. And then last, the best part is it notifies us when the courses have all been taken so that we can issue that certificate of completion for the peer mentors and notify the networks that they have completed the courses and take folks to that next step, which is bringing them together for orientation. Some of these this program is really designed to allow the networks and the facilities that are interested in being involved in the program to work together to decide what frequency do you need to have a peer mentoring and mentee orientation. We can tell you from the pilot project that once a peer mentor has completed the courses, they're eager. They really want to get started. They're hoping they've got a mentee that's ready to go too, and that might not always be the case. In the case where you have a fully engaged facility that's really promoted the program, and they may have a good combination and a nice selection of mentors and mentees and may be able to get right off the ground with it. Others may have an imbalance, one or more of the other, and kind of have to wait it through. So there's no magic formula as to how often you should have an orientation or how you should set that up. Might it be the third Thursday of every month, and I think some of it will be a little bit of trial and error and what works best for the facility, and of course, what works best for the peer mentor and mentee. We know again, through the pilot, we know that there's folks that are eager to sign up. They want to be involved. They know that they would appreciate the support from a mentor as a mentee, yet things get in the way. Life gets in the way. They have a grandson or a daughter that needs their focus more or less. They're not feeling well. They might have had an unanticipated hospitalization. Things that you all know are out there that exist that could slow the process down, and I think we have to be very mindful of that as we go through the program together. Next slide, please. So I just talked a little bit about this. One of the things that we have done is set forth for the ESRD networks a toolkit for them to share out with facilities who are interested in a peer mentoring program, to share out the resources and information available. But as of right now, obviously, orientation would be virtual, especially given the pandemic. And in some cases, it may be virtual always, just based on the distance that patients travel to and from their facility, transportation concerns, all of those things. But orientation is set for virtual. There's a section in there where we have in the resources as well as in the orientation for patients, peers to listen to a peer mentoring exchange. It's an exchange between a mentor and a mentee about vascular access, and we are working on a mentee-specific video as well that we'll be adding to the Kidney Learning Hub. The orientation allows them to review additional resources that are listed in the Kidney Learning Hub. There's a resource tab in there next to the peer mentor and peer mentee role, and there's a number of resources that are there, including the ESRD map of ESRD networks, so that folks that might find their way to this, somehow find their way to this and not really know what's going on can look up and see what network they're part of. There's a peer mentoring quick reference guide, and we, last but not least, encourage everyone to seek support from their ESRD network peer mentoring champion. And as facilities and networks collaborate and partner to create a successful, robust program, some of you out there, some facilities and networks have already done this. You've got really good things going on, and we can't let you say enough how much we appreciate that. But we said one of the recommendations we made was that the network and the facility assign maybe a dedicated person, a peer mentoring champion, if you will, to help facilitate and navigate and keep things consistent for the mentors and mentees, and keep that collaboration, those lines of communication open between the facility and the network as well. Next slide, please. So Stephanie talked a lot about confidentiality and privacy, and this came up as in our environmental scan. It came up in our literature reviews. It came up in our interviews with folks out there in the industry that have chronic disease management peer mentoring programs. Confidentiality ranked very, very high. So, of course, there is confidentiality waiver, as Stephanie mentioned, and there's a section of this in the orientation slide deck, which is just a template, and slides can be added to it or changed around in any which way you all may feel is important for orientation. But privacy and confidentiality are top of mind in ensuring that no mentors or mentees are paired together unless they agreed to sign the confidentiality. And they both sign and share the waiver so that they are confident that they have each other's trust in the matter. All personal information shared in mentoring sessions should be kept private. That is can't be stressed enough. It can't be said enough. It probably can't be written enough. And there's only really one exception to that. And Stephanie mentioned early on that we highly recommend that peer mentoring champions at the facility and the network have a check-in, that temperature check. How's it going? What's going on? To make sure that everybody is keeping information private and there isn't this one exception where somebody may say something like, I'm feeling really down, I haven't been out, I do dialysis and that's the only thing I go to, otherwise I'm not out of my home and I really don't know if I can continue. They might say something like that or something even deeper or more profound than that. And I think that if everybody understands and knows that could happen and that it's okay to say, I think we need to go ahead together and maybe we should talk to the facility social worker or we should let a staff member at the facility know how you're feeling. So that might be beyond my ability to be a mentor. Any forms, logs, or notes are considered private. There is a peer mentor log form. It is not tracking important personal information. It's actually tracking variables of the program. How many times did you meet this week? Did you talk about, it takes attributes of each of the courses out. Talk about being new to dialysis, or did you talk about how you might get a vascular access, or did you talk about peritoneal dialysis, or how to get on the transplant wait list, or things like that. They're very tactical measures in the log form, and we encourage mentors throughout the log form to not document personal information shared or between the peer mentor and the mentee. So mentors and mentees are encouraged to focus their sessions on the course topics and to establish boundaries between each other. And that's where maybe peer mentoring champions and orientation can really help out. The call frequency and times, the medical experience versus medical advice, and caregiver relationships. That was a big one that came out in the pilot as well. That, sometimes we're not all on the same frequency with our caregiving. Some of us are very successful, have very successful caregiving situations, and others of us don't. And we have to, that's a high sensitivity level that we need to help coach and make sure that judgments and perspectives are not brought into that relationship. Because when we compare ourselves to others, there's opportunity for a lot of dissatisfaction, which might not be the place we'd want to go to. And medical experiences versus medical advice. I think we've all been there. We've talked about it. I might have had a great or a not so great medical experience, but from that experience, we don't want mentors, obviously saying things like, well, and I think you might, or you should, or you could, or things like that. Those medical advices should all sound something along the lines of, that's a really good question. You should check with your nurse, or your tech might be able to help you with that, or check with your social worker. She may be able to, advance you some other direction. Next slide, please. So Stephanie talked a little bit about the peer mentoring application. There's really it's a two-form process. We think that most of the referrals for the peer mentoring program will actually come out of the facility. If a facility agrees to be involved in it and shares the promotional materials, they may get that question, that mentor or mentee that says, you know, I'd like to help, or I think I'd like to talk to a patient about some of the things I'm feeling. So there's a referral form that the networks can share with the facilities. It can be faxed back to the network, and assumptively, if the facility has sent that back, the peer mentee or mentor has met the qualifications that Stephanie outlined, and everybody's good to go. But there may be times that somehow the network might get a referral, somehow it might end up there, and so that might go backwards, back to the facility. And I think the real message in this is, again, we can't say it enough, the partnership and collaboration. It really, at no time in the peer mentoring program should we find ourselves with a mentor or a mentee that one or the other of those organizations doesn't know is involved in the program. We want that open transparency. And there's an opportunity that could happen in that ESRD NCC. That's Stephanie and myself and the team that we have on the call with us today have a vital role in it as well, because when if someone logs into the learning management system and we go into the tracker form for the network and we don't see a referral or they haven't completed, we have to notify them to say, you know, Julie Moss has logged in and created an account. We don't see her. You know, you better check with her facility and make sure that she might have been referred and you just haven't gotten the paperwork. Again, we found in the pilot that people who wanted to be involved, the patients who wanted to be involved, were gung-ho. And as we know in our daily workflow, we can get behind, and that our paperwork might be waiting to go through the fax. It could be in the iCloud somewhere, you know, transporting itself between the two of you. So we have to be patient with that, but the transparency to make sure that everybody knows that there's where everybody is in the program is really important. Pairings are focused on the mentee topic, interests, hobbies, and gender preferences. That is one of the questions that's asked in the application. And the topics of interest, again, really align themselves with the peer mentor courses. They don't really go too far out of that. We will be relying on networks and facilities to your network to tell us of possible topics that could come up for future course development and things like that. If we haven't hit the mark on what mentors and mentees want to talk about, then we might have to take a look at that and strengthen the program. And that's certainly something that we can take a look at. Hobbies are important because they break the ice. I'm probably not telling anyone on this call something they don't already know, but they help break the ice. So if I enjoy sewing, someone else enjoys, needle pointing or crafting, or I get close and get a perfect match of sewing, that might be an area. And I'm also interested in learning about home dialysis. And I'm been on the transplant wait list for 2 years. I start finding those similarities and connect with those to help keep that open communication between mentors and mentees. We did find during the pilot, we had a case where we had a mentee and a mentor match, or possible pairing, I should say, and the mentor was male and the mentee was female. I might have it backwards, but either way, they preferred to meet with somebody of their own gender. So that particular pairing did not work out. So that is the reason for gender preference there. To some people, it may not matter at all. To others, it may be very important. It's also, and I mentioned this earlier, it's really important that we follow, without being, in the business of mentoring ourselves, follow the pairings, because mentors and mentees may request a new pairing. There's times where a mentor may be really gung-ho, and the mentee comes down with something keeps them, or they're just not sure, or We talked a lot in the pilot and a lot with the networks that we shared in Stephanie's slide. We talked a lot about, how easy it is to want to help somebody and how difficult it is to ask for help. And sometimes, even though we've done everything we can to bring the two of them together, we've got that referral, we've got the application, we've had the teleconference call, we've had an orientation, there's still that hesitation or something gets in the way and it doesn't quite happen. So that's okay. And we have to be sensitive to that and that we say that's on the table really between the facility and the network and that peer mentor champion, that one consistent representative that they have to help kind of figure out what's going on with that. Is it a day of the week? Is it any number of reasons that it might not? And Stephanie said this several times, mentors should not be paired with more than 2 mentees at any time. So, we haven't specifically said it here, but most likely they should not be together. They should be individual peer mentee-mentor relationships that exist. So if Julie Moss is a peer mentor, she might have Stephanie Hall and Jane Doe as her mentees, and one might meet on Tuesday and one might meet on Thursday. And there's no real specific set of time either. My questions on Tuesday might be, I only have 2 or 3 questions, but next time I meet, because of information my mentor shared, we might spend maybe 45 minutes together, or other things may come up. So there's no written in stone amount of time, but we're hoping that it would be a relationship that develops and grows and strengthens itself, which would probably take a little bit of time, not necessarily just answer the question. Next slide, please. So staying connected virtually, we've done a lot of work in ensuring that there's ways that patients can connect with each other in a virtual world at no cost and not worry about, obviously, that face-to-face contact especially during the pandemic. So we've encouraged, in the orientation, we encourage you not to share your personal cell phone or landline telephone numbers, and not to share email addresses. And we have a Staying Connected Virtually document in the toolkit that helps, but using Google Voice, it's an iOS and Android feature. It's free. It's free domestically, which our mentors and mentees would be. We give you instructions on how to create a Zoom account, which gives you free Zoom capability. I think it's up to 45 minutes should you wish to choose to use that, and you have a computer. The Google Voice, the good thing about it is if you don't have a computer, but most likely you're going to have a computer because if you're a mentor, you've taken the courses, although it's all set up in a mobile fashion, probably easier to do on a computer. At least the Google Voice allows you to text and call one another in a phone number that is obviously not your personal cell phone number. Next slide, please. So I referenced this a little bit ago. Mentors monitor and track progress. There's a mentor log form, and here I know it's super small, but it talks about how many times did you meet this week. The answers are we did not meet this week, 1 time, 2 times. What prevented you from meeting? So we're trying to understand, is there a gap in the relationship, or is it a scheduling problem, or what might it be? How long was your meeting? 30 minutes or less, 60 minutes or less, more than 1 hour? Did you meet via Zoom or Google Voice? Those are our 2 companion virtual platforms that we recommended. They were easy and free. And what topics did you discuss? Again, it's that home hemodialysis, peritoneal dialysis, and center dialysis transplant, ESRD overview information, new to dialysis, and other. And we we say, please only tell us the topic. Do not explain the conversation. We really don't want to know what the conversation was. We just want to know what the topic may have been. And obviously, as I said before, if we see a trend in that, that might be something that we need to support. So the peer mentors, it just measures the activities for mentoring, and we encourage not to share the discussion. Again, can't be said enough for everybody, for the facilities, for the peer mentees, mentors, and networks. Next slide, please. So tips for operationalizing your program. This is from a network perspective. This first one, engage the facility, engage the facility representative to promote the ESRD network peer mentoring program. Many facilities out there and networks have highly engaged facility patient representatives. Such a great resource. They're boots on the ground, and they bring a lot of information back to each of you, so we encourage that. Discuss the ESRD Network Peer Mentoring Program and ways to promote it during the monthly quality meeting or your QAPI meetings. That's important as well, because I think if peers feel supported and valued, the possibility for growth and bloom is there in that grassroots approach to it, and it organically can flow. So we encourage that. Display or share the promotional material from your network, and we have posters and brochures that are generic about the program, as well as specifically talking to a mentor or a mentee. If you have a facility newsletter and it's going out to folks and stakeholders, you might want to promote it there. Smaller or rural dialysis facilities may consider partnering with one another and nearby to support, because you may be separated, but the patients that you have going to each of these facilities may actually be closer, or may actually already know one another, or feel supported, or be comfortable in that opportunity to get that mentoring or mentee relationship underway. And larger facilities may consider pairing one mentor with two mentees, and we've talked about that. So if you have a load of mentees, that certainly could work out possibly. Next slide, please. So in summary, the program is a way to engage patients in their care and increase their knowledge, competence, and social support. Peers can benefit from connecting with a peer who has found ways to thrive, improve goal setting, improve self-efficacy and knowledge and social support. And facilities could greatly benefit from the peer mentoring program through increased patient engagement, improved quality of life, perhaps improved mental health, patient mental health, and possibly improved clinical outcomes. I think there's a lot to be said. We learned in our work at the National Coordinating Center through our National Patient and Family Engagement Learning and Action Network, our team that does that, we've learned an awful lot from patients about how when they feel that they have an opportunity to thrive, it just seems a little bit easier, all of it. And they're really able to, a lot of them are able to thrive with that support. So we are hopeful that this program will give that organic growth to that support and thriving. Next slide, please. All right, so we are at questions, which I think Stephanie or Matt is on as our NCC host today, will help us do our best to answer. And I do want to ask that when we close the loop, if we can copy out the questions that came in the chat, so in case we can't get them all answered today, there's an opportunity for us to send back out to the networks maybe a Q&A sheet.
Sure, Julie, thank you. We did have some questions that came in. Please remember, if you have any questions for us, to submit in through the chat in the Q&A. But I will go ahead and Julie, I'll take this first, or at least start it off. A question came in, and it says, why would you implement such a program with high COVID numbers? And that's a really good question. It does sound like this is not the best time. But I do have to share that during our pilot and our development of this program, we had, as we mentioned, involvement and feedback from networks, CMS, patients. And ironically enough, we thought that, again, and we're not saying this, you have to do this, or it was just, these are just suggestions and guidelines, but actually a facility that does have a high number of COVID positive patients and cases, those patients may actually need that extra support, emotional support. And especially maybe somebody new starting dialysis into this, already starting dialysis is a huge, adjustment psychologically. And then starting it in the world of COVID, I can't even imagine. And so I really think this is a very important time, that if there is feelings of isolation and already, that this could be a good time for facilities to think about that. And that's all we're suggesting, is possibly thinking about that for facilities. So, Julie, anything you wanted to add to that, or?
Nope, I agree. It came up during the pilot. Definitely. Okay.
Yeah. And I'll give one to you, Julie. It's just, can the patient representative also be a peer mentor?
Sure. I think, again, if that patient representative, if you go back to those qualifications and they've been, on in-center dialysis for at least 6 months and dialysis over a year, and they meet those criteria and parameters, they may be able to do both. And you just want to be really careful, to make sure we keep a close eye on not burning out our patients that are really energetic and go-getters. We don't want that to happen because we need them.
Yeah, right, exactly. I will take this one. It just says, please explain once more the difference between the peer mentor champion and a peer mentor. Good question. I know there was a lot of talk about that. So let me see if I can clarify it. The peer mentor champion is someone at the network level that's identified there that will sort of be the go-to or the contact person for facilities in their service area and in their network, that they could go and know who that person is, go directly to them for questions that help support them to get this peer mentoring program up, or once it's up, to help support them. And the peer mentor is a patient within your facility who is willing to take the courses that we mentioned, to finish those quizzes, to go through the orientation, and then be paired up with a peer mentee. So I hope that clarifies that. But very good question, because those two terms can get a little bit foggy and very unclear. So the peer mentor champion is someone from the ESRD network who sort of is going to be the point person for the peer mentoring program. Okay. Julie, any more?
I would only add that, maybe the facility wants to assign, they might not call them a peer mentoring champion, but the facility might also want to have a staff person, so you get that consistency. So the peer mentoring champion at the network knows who can they reach out to at the facility, who might be their contact. But other than that, yep.
Yeah. Okay, another good question here. It says, what's the length of time that's recommended for mentors to commit to one peer relationship? Minimum number of weeks, they're asking. Well, that's a good question. We never put that anywhere in there. I think originally we talked about the minimum of 4 weeks, but again, this is really between, I think, the networks and the facilities, and in between the peer mentors and mentees. It could go 6 weeks, it could go longer. I do think that is a kind of a case by case maybe, but like I said, we sort of looked at maybe about 4, and not 4 weeks, but 4 sessions. So however that may be, but really going to leave that up between the facilities and the networks to make that decision. And I'm going to punt this one to you, Julie. Let's see, next one here. Can a visually impaired patient who cannot see to read participate as a mentor?
Yes.
Yeah.
They should be able to participate as a mentor. The one challenge of that we are, quite frankly, working through is the quiz. However, if a visually impaired individual, not totally blind, but visually impaired, has a screen reader, all of our materials are 508 compliant. So if they have a screen reader for their computer, they should be able to see that information. But I think that there's more than one way that we can work through visually impaired. Obviously, they have the audio courses, but going to take the quiz, and that is something we have, again, on our list here at the NCC, is managing how they might get past the course quiz in that impairment. But at this point, I don't think we should be in a place where we exclude anyone other than those who might not meet the criteria. They haven't been in center, or the list that we put forth earlier, and it is part of the network work.
Yeah. We got time maybe there is a couple quick ones I think we can answer. It says, will the recording of today's presentation be provided to the networks? And yes, absolutely. We'll send the slide deck out and that you can share with your facilities in your service area. That definitely will be going out probably by the end of the day tomorrow. Another quick question asked, if no one in our facility wants to be a mentor, can we call a facility near us? Of course, that's exactly what we'd like to. That's a great question, and you're already thinking. That's really great. They don't have to be in the same facility. We, of course, ideally thought that was pre-COVID the way it would work, but now we understand that that may not possibly be always the case. But if you have a sister facility within your same organization, and there's a mentor there, definitely connect with them and utilize their mentor. That's a great way. Thank you for asking that. And a question here, where can we find material related to the peer support program that we can distribute to our patients?
So, Steph, it's Julie.
Yeah.
ESRD networks have been given access to, now it's not an all-inclusive end-all be-all, but a guiding operational toolkit that is chock full of promotional materials like a facility poster, a brochure that's generic for the peer mentoring program, as well as a specific brochure or flyer for a peer mentee if somebody came and said that they need help. And then there's one specific for a mentor. So the network has access to the materials, and of course, anyone who's on the call today, if you go into the Kidney Learning Hub, you can email the NCC directly from there, and if we receive an email from you, we will absolutely coordinate with your network to make sure that you get anything that you think you might need or that we have available.
Right. Trying to think, we have like 2 more minutes here. And I think you just answered one. Somebody else, how does the facility get the good? We got that answered. And again, I want to clarify because a few questions came in about does the patient have to, and the mentor and mentee have to be from the same clinic? No, they do not have to. If you've got another facility that you're willing to share and partner with, or reach out to your network, maybe they have mentors from other areas that even not really geographically are close, but are willing to call and connect through to another facility. That's perfectly fine. So yes, we don't want to make that restrictive. So, and again, the slides will be shared out. And I think we're going to wrap this up and these other questions we'll look through, and maybe we'll send these out when we send out the slides. We'll go through them and answer them if we have not already. So a lot of good questions. I'm happy to see that, and people sound like they're very interested to get more information, and they're excited about this peer mentoring program, I hope. So I think anything else, Julie, I think we'll close. It is 3:59. We really want to keep this call on time. Thank you again for taking time out of your day to join us for this webinar. I hope it's been helpful. More to come, and thank you, everybody. We appreciate you being here. Thank you for all you do. Have a good night.
Take good care. Bye-bye.